Welcome to this deep dive, where we explore the often unseen layers of important topics. Today, we're focusing on hyperbaric oxygen therapy.
Right. That's the method involving breathing pure oxygen in a pressurized chamber.
Exactly. It's known for potentially boosting oxygen delivery, which can help healing for certain conditions.
And while those potential benefits get quite a bit of attention, we thought it was really important to spend this time looking at the other side of the coin.
The possible risks and side effects.
Precisely. The things that can sometimes accompany this kind of therapy.
Okay. And our aim here isn't to, cause alarm, but really to offer a clear, balanced view. We're drawing on sources like the European Guidelines for Hyperbaric Therapy and the Handbook on Hyperbaric Medicine.
Yeah, we want to carefully examine what the science and guidelines tell us about potential downsides so you, the listener, have a good understanding.
So let's start maybe with the environment itself, the chamber.
Okay, so the therapy happens inside this hyperbaric chamber. It's actually a medical device, specifically built to handle significant pressure.
And there are different types, right?
That's right. Mainly two kinds. You have the single-person chambers monoplace, they're called. Access from outside is pretty limited during treatment there.
Okay.
And then there are multi-person or multi-place chambers. These can fit several people. And crucially, they allow medical staff, attendants, to be inside with the patients.
Now, here's something that seems really key. The European guidelines actually point out that this whole pressurized environment itself, well, it carries inherent risks.
It absolutely does. It's a very unique setting, and it demands careful management.
So how do facilities deal with that inherent risk?
Well, because of these built-in risks, the advice is for facilities to do thorough risk assessments, meaning they carefully look at all the potential hazards, things related to the chamber environment, the equipment they're using, even human factors.
Ah, okay.
And the whole point is to have well-thought-out procedures ready to minimize any potential problems.
That makes a lot of sense. I mean, if you're going into a sealed, pressurized space, you definitely want reassurance that every possible safety angle has been covered. And I guess being ready for things to go wrong is part of that, emergencies.
Absolutely critical. The guidelines really stress having clear emergency operating procedures. These are for handling predictable medical events or, equipment issues that might pop up.
But aren't emergencies always complex?
Yes, but what's notable here is that even routine emergencies can become much more complex inside that pressurized environment.
Ah, I see.
Which is why regular practice drills are essential. Everyone needs to know exactly how to respond effectively under those specific, unique conditions.
So it's not just having a plan on paper, but actually practicing it in that setting. And like any complex bit of kit, I imagine keeping it maintained is vital too.
Oh, without a doubt. Keeping the hyperbaric system in safe working order is just fundamental.
What does that involve?
It means following detailed maintenance procedures and also keeping really comprehensive records of all the maintenance actions, plus logging any technical incidents or malfunctions that happen.
You mentioned malfunctions. In a pressurized, oxygen-rich place, that immediately makes me think about, well, fire risk. I think there have been historical incidents.
That's a very serious concern, and yes, you're right. Past incidents of fires inside hyperbaric chambers really underscore a significant risk.
Why is the risk higher there?
Well, you've got the increased oxygen concentration plus the pressure. It means there's just much more oxygen available to fuel a fire. If something does ignite, it can burn much, much faster and more intensely.
Wow. Okay.
And that's why there are incredibly strict safety rules about what can and cannot be brought into the chamber. Things like static electricity, certain materials, it all needs careful control.
Okay, so the environment itself has risks. Let's shift gears slightly and think about the operation of the chambers and the equipment. Those European guidelines you mentioned seem to list quite a few potential issues there too.
They do. And it's important to frame this correctly. These are potential risks identified through experience and careful analysis over time. They aren't things that happen constantly, but things facilities need to guard against.
Understood. So what sort of things are on that list?
Well, some key concerns linked to chamber operation include things like the control panel alarms. Maybe they don't function correctly, or perhaps they're set to the wrong levels.
Which could affect the treatment pressure or time, I suppose?
Exactly. That could lead to improper treatment. And that clearly relies heavily on the skill of the operators.
Right. What else?
Other potential risks include contamination inside the chamber, or, as we've discussed, the possibility of fire. There's also the risk, potentially, of hypoxia, not enough oxygen or even poisoning from gases used in the system if something goes wrong. Managing humidity is also surprisingly important. If it's incorrect, it can cause discomfort, sure, but also potentially lead to sparks or fire or affect the equipment.
It really does sound like a self-contained, very specialized little world in there.
In many ways, it is. Even the speed at which the chamber is pressurized, the compression rate, that's a factor. If it's not controlled carefully, it could potentially cause injury to the people inside.
Injury from the pressure change itself.
Yes, potentially barotrauma, which we can talk more about. Also, problems with the chamber's exhaust system, maybe poor design or a malfunction that could lead to noise issues or pockets of high oxygen concentration or even suction injuries. And maybe surprisingly, decompression sickness.
Wait, decompression sickness inside a hyperbaric chamber. Isn't that what it's supposed to treat?
It is usually. It sounds counterintuitive, I know.
Yeah.
We could delve into that a bit more later. It relates to pressure changes.
Okay, interesting. Keep going with the operational risks.
Right. So other things. Chamber lights malfunctioning or short-circuiting. That's not just inconvenient for patient care, it's another potential fire hazard. Heat sources inside the chamber also need careful control. Overheating is a risk, but also insufficient heat could lead to problems, potential burns, or even hypothermia depending on the situation.
It's a delicate balance.
It is. And even seemingly small things like loose cables or wires can be hazards. People could trip, the wires could get damaged and cause sparks or shocks, or again, potentially fire.
Oh.
And finally, the compressors that supply the high-pressure air. They need really rigorous, regular maintenance to prevent failures or, crucially, contamination of the air being supplied. Contaminated air could lead to infections or intoxication.
That is a very comprehensive list. It really drives home how many different things need constant, careful management and monitoring.
Absolutely.
And it also seems to highlight why, as those guidelines suggest, having specialized, highly trained people like experienced chamber operators is so essential, especially for those bigger multi-person chambers.
Couldn't agree more. The human element, the expertise, is crucial for safety.
Okay, so we've talked about the environment and the operations. Now let's turn to how the actual treatment, the increased oxygen pressure, can affect the body physiologically. What are the potential risks there?
Right. To get a handle on some of these potential risks, it helps to just touch on a couple of basic physics principles.
Right.
You might remember Dalton's law.
Vaguely. Something about gas pressures adding up.
Exactly.
Yeah.
In a mix of gases, the total pressure is the sum of the individual gas pressures. And then there's Henry's law.
Okay.
Henry's law basically says that the amount of a gas that dissolves into a liquid is related to the pressure of that gas above the liquid.
All right, so in the hyperbaric chamber, you're breathing pure oxygen at a higher pressure. So applying those laws, the pressure of oxygen is much higher.
Correct.
Which means, according to Henry's law, more oxygen dissolves into our blood and other body fluids.
You've got it. That's the fundamental principle of how it increases oxygen delivery. But this increased dissolved oxygen also brings potential issues.
Such as?
Well, one of the main concerns is the potential for oxygen toxicity. See, at these higher oxygen concentrations, our body can actually produce more of these very reactive molecules called free oxygen radicals. Things like superoxide ion, hydrogen peroxide, hydroxyl radical.
Ugh, free radicals. I know those are generally linked with the potential cell damage.
That's the concern, yes. Normally, these radicals are mostly kept in check, contained within the mitochondria, the cell's powerhouses.
Okay.
But their production ramps up when oxygen levels are high. Now, our bodies do have natural defenses, antioxidants like vitamin C and E, enzymes like glutathione peroxidase.
Right, the body fights back.
It does. But the question is, under the stress of very high oxygen levels, it's not completely clear if or how these excess radicals might sometimes overwhelm those defenses and escape to cause damage elsewhere in the cell.
So our natural defenses might have their limits when faced with, say, very high oxygen pressure or maybe prolonged exposure times.
That's essentially the concern. And this potential toxicity can manifest in different ways. One is pulmonary oxygen toxicity.
Affecting the lungs.
Yes. Lung function can be affected if the dose of oxygen, which means both the pressure and the duration of exposure, is too high. And individuals vary in their susceptibility too.
Dose matters, like with medication.
Exactly. And interestingly, it seems the mechanical aspects of lung function, like lung elasticity, tend to show effects earlier than the lung's ability to actually exchange gases.
Okay. And wasn't there something about the nervous system potentially being affected too?
Yes, absolutely. Central nervous system oxygen toxicity is another significant potential issue. Lab studies looking at nerve cells in culture exposed to high-pressure oxygen have shown things like increased activity of an enzyme called lactate dehydrogenase.
Which indicates?
It can be a sign of cell stress or damage. And they've also observed decreased cell survival in those conditions.
And do they know why?
Well, the thinking is it might be linked to the activation of certain receptors in the brain, specifically NMDA receptors, and maybe the production of nitric oxide. But it's complex.
So it's not just the lungs we need to think about. The brain is potentially sensitive too.
Correct. And there are other physiological responses too. For instance, hyperbaric bradycardia.
Low heart rate.
Yes, a temporary slowing of the heart rate during the exposure to high pressure. It's been observed fairly consistently.
Any idea why that happens?
The prevailing theory is that the increased oxygen levels affect the autonomic nervous system, the part that controls involuntary functions. Specifically, it seems to increase the activity of the parasympathetic nervous system, which tends to slow things down.
Interesting. And does the opposite happen too?
Sometimes, yes. Decompression tachycardia, a temporary increase in heart rate after returning to normal pressure, can also occur.
So our heart and blood vessels are definitely reacting to these shifts in pressure and oxygen.
It appears so. Animal studies have also suggested that high-pressure oxygen can affect blood flow to various organs and impact the heart's overall pumping efficiency, the cardiac output. But the exact details and implications in humans are still areas of ongoing research.
Okay. Now, another thing related to pressure changes that I've heard about is ear barotrauma. Can you explain that?
Sure. Middle ear barotrauma is quite common, actually. It happens when the pressure inside your middle ear doesn't equalize properly with the changing pressure outside, like during the compression phase when pressure is increasing, or decompression when it's decreasing.
What does that feel like?
It can cause discomfort, fullness, pain, and sometimes even damage to the eardrum if the pressure difference becomes too great.
Can anything be done to prevent it?
People are taught techniques to equalize pressure, like yawning or swallowing. And interestingly, some research has looked into whether using very slow compression rates when starting the treatment might help lower the risk.
Makes sense. Slower change, more time to adapt.
Potentially.
Yeah.
But it's definitely known that ear-related complications are associated with hyperbaric oxygen therapy. It's probably the most frequent side effect reported.
So even though the therapy isn't aimed at the ear, the pressure environment itself can cause issues there.
Exactly.
Now, let's revisit decompression sickness. You mentioned earlier that while hyperbaric oxygen is a primary treatment for it, especially in divers, the hyperbaric environment, the pressure changes involved in the therapy itself, could potentially contribute to dysbarorism. That's the broader term, right? For pressure-related problems.
That's correct. It's a really important point. While we use the chamber to treat decompression sickness by helping nitrogen bubbles dissolve, the rapid pressure changes involved in getting into and out of the chamber can themselves cause other pressure-related problems.
Like what?
Well, for instance, pulmonary barotrauma. This is more often seen in divers during ascent if they hold their breath. Gas trapped in the lungs expands as the pressure drops.
Boyle's Law.
Precisely. And this expansion can potentially lead to rupturing the tiny air sacs in the lungs, the alveoli.
And that can let air escape.
Yes, potentially into the chest cavity, or, more seriously, into the bloodstream, causing an air embolism. This is noted as being perhaps more common in less experienced amateur divers who might not manage their ascent properly.
Air bubbles in the bloodstream sounds incredibly dangerous.
It can be extremely serious. Cerebral air embolism is when these air bubbles travel to the brain and block blood flow.
Cutting off oxygen to brain tissue?
Exactly. It can cause ischemia, hypoxia, swelling,
Yeah.
a whole cascade of problems. And sometimes, even after the bubble itself dissolves or moves on, blood flow might not properly return to that area, something called the no-reflow phenomenon.
Why does that happen?
It's complex, but the initial blockage can trigger other processes, things like platelets getting activated and clumping together, or white blood cells sticking to the walls of the blood vessels, which can further impede flow.
It really underscores how critical, careful, controlled pressure changes are.
Absolutely, both in diving and within the therapeutic chamber environment.
Now, I know for some groups of people, medical treatments require extra caution. What's the situation with a hyperbaric oxygen therapy during pregnancy?
That's a really important question. Using hyperbaric oxygen during pregnancy, even for something like carbon monoxide poisoning, or it might be standard treatment otherwise.
Yeah.
Well, it's been quite controversial, or at least approached with significant caution.
Why the concern?
It mainly stems from worries about potential negative effects of those very high oxygen partial pressures on the developing fetus. Animal studies have raised some questions.
So what's the bottom line?
The bottom line is that the decision to use hyperbaric oxygen therapy during pregnancy requires a very careful individual weighing of the potential risks versus the potential benefits for both the mother and the baby. It's not undertaken lightly.
That makes complete sense. You need a very compelling reason to expose a developing baby to that kind of environment. Are there any other sort of miscellaneous considerations or limitations we should touch on?
Yes, a couple of others are worth mentioning, though our sources didn't go into extreme detail. For some patients receiving this therapy, especially if they're critically ill to begin with, they might need quite intensive hemodynamic monitoring, tracking heart function, blood pressure, that sort of thing, while they're actually inside the chamber.
Which adds another layer of complexity.
It does. Also, there's a practical point about monitoring tissue oxygen levels. There's a non-invasive method called transcutaneous oxygen tension measurement. It uses heated sensors on the skin.
Okay. Useful for seeing if oxygen delivery is improving?
Potentially, yes, but it generally cannot be used inside those single-person monoplace chambers.
Why not?
Because of the fire risk from the heated electrodes in that 100% oxygen environment.
Right back to the fire risk we started with, so that useful monitoring tool might not be available depending on the chamber type.
Correct. It's another constraint of the environment.
Well, this has been incredibly informative. We've really covered a lot of ground regarding the potential risks and side effects tied to hyperbaric oxygen therapy. It seems really clear that while it definitely offers potential benefits for specific medical conditions, it's not a simple treatment. It's complex, and it comes with potential downsides that absolutely need careful management and consideration.
That really is the key takeaway message, I think. Hyperbaric oxygen therapy can be a valuable tool in the medical arsenal, but it's vital that everyone involved, patients and providers, is aware that it does carry potential risks and side effects.
And that awareness leads to emphasizing safety.
Exactly. It underscores why treatment is ideally provided in well-equipped facilities, staffed by highly trained professionals who rigorously follow established safety protocols and have well-rehearsed emergency procedures ready to go.
This deep dive has definitely given us, and hopefully you, our listener, a solid foundation for understanding these potential risks. If you are considering this therapy or perhaps already undergoing it, we really encourage you to use this information as a starting point for further discussion.
Absolutely. Talk to your healthcare providers, ask questions, make sure you understand the potential benefits and the possible risks as they apply to your specific situation.
Being fully informed is always crucial for healthcare decisions.
Couldn't agree more.
So, to wrap up, here's a thought to leave you with. Given everything we've discussed, the intricacies of the pressurized environment, the various physiological effects of high-pressure oxygen, the operational complexities, what might the future hold, what advancements in safety protocols or maybe monitoring technologies could further enhance the safe and effective use of hyperbaric oxygen therapy down the line?
That's a great question. It's certainly a field where ongoing research, technological development, and a continuous focus on refining safety practices are absolutely essential.
Ensuring patient safety has to remain the absolute top priority. Thanks so much for joining us for this deep dive.